Hello, I'm Dr. Bill Gradishar, Professor of Medicine at Northwestern University, and I want to welcome you to this Yerbba YouTube video that's focusing on one of the presentations at the recent ASCO meeting, which just concluded last weekend, actually at the beginning of this week. And it really focused on whether abiding by a Mediterranean diet can have some impact on breast cancer recurrence. So, of course, all patients want to have some part in their cancer therapy and their journey. If they can, they always ask, are there things that I can do that are going to reduce my risk, whether it's exercise, cutting back on alcohol, whatever, many of the topics that we've talked about in these videos before. And, patients go to extremes with diets. They cut out meat. They're only going to eat vegetables. They're going to become a, vegan, all these different things. And oftentimes they sound good, but we don't have clear evidence that it necessarily always impacts on patients' outcomes as it relates to breast cancer. So the study that was done from Italy actually looked at whether a number of different elements might contribute to reducing the risk of breast cancer. And that included a group that was actually abiding by the Mediterranean diet, which they recommended, and I'll get into what that meant in a minute, as well as encouraging exercise. And the other group were doing the same thing, but they also had somebody that was sort of calling and making sure they were doing it. So there was more of an intervention, not just handing a sheet of paper to tell people what to do, but somebody actually, in a sense, hounding you to make sure you were doing it. So exercise was encouraged, as well as the diet. And the diet that was given, the so-called Mediterranean diet, or what was recommended to be the composition of that diet, was rich in vegetables and things like beans and chickpeas and nuts and whole grains and fruits, fish, etc. Things that were moderately allowed, meaning moderate amounts, included poultry and eggs and dairy products. And then, of course, what anyone would suggest, just trying to be healthy in general, forget the study for a moment, is to try to limit highly processed and packaged foods, anything that's excessively sugary, excess alcohol, cutting down on red meat, etc., things that you've all heard for years. So the diet was really something that patients were encouraged to stick with. And by doing so, the question that was being asked, if you put all these elements together, might it impact on the risk of hormone-sensitive breast cancer? And I will say that one of the interesting things and one of the more maybe amusing things that was asked during this presentation, or once it was over, because it was being done in Italy, is did they control for alcohol consumption? Because as the presenter admitted, Italians like to drink wine. And they actually said, no, we didn't control for that. So, that's a little bit of a flaw, and it got a humorous response from the audience. So the study included patients with hormone receptor-positive breast cancer, and these were patients who had completed their local therapy. They could have had low-stage disease or high-stage disease, and they were all enrolled in Italian hospital centers over a period of about 12 months, and the study ran for almost 3 years. And as I mentioned earlier, the elements of the study were a low-glycemic Mediterranean diet, 30 minutes of brisk walking, and then vitamin D supplementation. And what the study was actually evaluating is breast cancer recurrence, disease-free survival, weight and BMI, body mass index, metabolic syndrome, and overall cardiometabolic health. And again, the study was successful in the sense that it demonstrated that by abiding by the diet resulted in weight loss, and as a consequence of that, your body mass index became less. There was a reduced prevalence of what we call metabolic syndrome, where patients can become glucose intolerant. And it also demonstrated that there were fewer recurrences among patients with hormone receptor-positive breast cancer. And that was probably the one piece of this that generated the most interest, And again, the reasons for why that may be by abiding by this is multifactorial. Obviously, if you can reduce weight and the amount of fat that is present in your body, which can be converted into estrogen, that's a good thing. Obviously, exercise is improving your overall health. It's maintaining your muscle mass. It's perhaps also offsetting the fatigue that many patients might experience after therapy. So sort of a corollary, other things that are good about doing this that don't necessarily have anything directly to do with breast cancer. And also by reducing weight and exercise to do so, you're improving sensitivity to insulin. And this is also making sure that your sugars stay in good control. Now, by reducing your weight, body fat, and decreasing the amount of estrogen that can be a consequence of that, you're also reducing your risk of breast cancer. And part of this has to do with the fact, at least theoretically, that fat can promote inflammation, and inflammation can cause an environment that's more suitable for the development and progression of breast cancer. Also, when you have a lower glycemic diet, your insulin levels are lower, and some of the growth factors that are involved in the metabolic pathway can be affected, and as a result, reduce their stimulation of breast cancer cells. So inflammation and just the general environment as a consequence of having lower blood glucose levels is actually a negative for cancer cells, which is a good thing. So again, all of these elements together can potentially reduce the risk of breast cancer recurring. And at the same time, by doing these things, you lose weight, your muscle mass is improved, your exercise tolerance is improved. So hopefully you would generally feel better, and it may have, most importantly, a potential impact on your risk of recurrence. If you'd like to get more information about personalized treatment paths, including the different therapies that are available that might be appropriate for your situation, tailored to your tumor biology and health profile, you can get a Yerbba report which breaks down chemotherapy regimens, endocrine treatments, and other combinations, and provides specific information that may be appropriate for your case. And you also have an opportunity to interact with Yerbba's medical experts directly for evidence-based answers about your options, recurrence risk, or side effects from the therapy you have by going to yerbba.com. So I think it's important to tell you, as I did, what the study showed, that obviously by abiding by a low glycemic diet and exercising, you may create an environment where you reduce the risk of breast cancer. So that's actually a great thing, and it's something that you can actually partake in yourself. But it is not a substitute for medical treatment for your breast cancer. So diet alone is not going to reduce your risk. So if it's recommended that you receive other treatments, they must be done as well, because they're going to be foundationally what most reduces your risk of the disease coming back. The other thing it doesn't tell us is whether this can have a preventive effect. In other words, by abiding by this particular intervention, could you prevent breast cancer from ever happening in the first place? Although I will say that exercise and watching what you eat is generally a good thing for your overall health. And it doesn't tease out what element of the diet was actually most contributing to your risk reduction for a breast cancer recurrence. So we can't actually define that specifically. So I think, again, whether this is going to actually affect you and your situation with your breast cancer risk is impossible to say. However, the study does support doing exercise, watching your diet, and in fact, it may have a risk reduction for ever having breast cancer recur. So, the bottom line is get up and out of that chair. So any level of exercise you do is better than doing none. Anything that has some impact on your overall health would be a good thing, and exercise will never be discouraged by any healthcare provider. So do that. And if you can modify your diet, even in modest ways, focusing more on vegetables, fruits, beans, lentils, that kind of thing, and minimize the amount of red meat, that's also a good thing. And the downstream effect could very well be a reduction in the odds of breast cancer recurring. So I want to thank you for watching this Yerbba video. We hope that you learned something from it. And if you're interested in other topics that we've discussed, subscribe and go to yerbba.com for more information that may apply to your individual case. I look forward to talking to you again in the future. Thank you very much.